Hi, I'm Valerie Hellerman, and I'm the project manager for the Tibetan Children's Education Foundation, and we're going to Zanskar. Zanskar is in the northwest Himalayas. It's a really remote Buddhist region. In 2014, our foundation had been invited to Zanskar to assess the healthcare systems. When we got there, we found that it was really remote and that due to the topography, people are isolated 5 to 7 months of the year. And so Western healthcare was pretty non-existent. There are amchis, which are the traditional healers, and their medicines are herbal and they are taught by oral tradition. And they do meet some needs of the people, but there was definitely a need for some Western healthcare. So while we were in Zanskar, we had an audience with His Holiness the Dalai Lama. During that interview, he told us that if the Chinese policy continues as it is in Tibet, that Zanskar would be the last authentic Buddhist culture and that we must continue our work. So the next day we were whisked away to the Zanskar Himalayan Health Committee's meetings, and we then started the process of becoming involved with providing healthcare in Zanskar. The Dalai Lama Fund has given money to build a hospital, the construction is finished and will be ready to open in June, which is when we arrive, 3 doctors, 5 nurses, and some ancillary people to do some medical camps and to educate healthcare workers. We're really excited. Dr. Vicki Chapman, who is from Great Falls, Montana, will be doing a women's health clinic where she'll be screening for cervical cancer and doing colposcopies. Cervical cancer is one of the biggest killers in India of women. So this will be a really good thing that we can address. Dr. Mark Gibson, who's an emergency care physician, will be doing 2 clinics, one a pediatric clinic, specifically screening for heart problems in children. There's a lot of congenital heart problems in this area, and it's due to high altitude, low birth weights. We have an area, we have a hospital that we can refer these children to in Leh. So we're feeling good that we'll be able to at least screen and diagnose them. The other problem is rheumatic fever because of untreated streptococcus infections. Here in the West, if your child has a sore throat and a fever, you take them to the doctor, they get antibiotics, the strep goes away. In this region, it's untreated, and so it goes into rheumatic fever, and one of the side effects of that is valvular heart disease, which can, manifest when they're young, teenagers, or even into adulthood. So we'll be screening for that. Dr. Ibsen will also be doing a general health clinic, and that will be for, just the general population. We're really excited about doing this. We also have a nurse who has taken on organizing a health assessment teaching program so that the local healthcare workers can learn how to assess and treat in emergencies while they're isolated for 6 to 7 months of the year. We are teaming with the Global Midwives Education Foundation out of Livingston, Montana. And they're coming in. Dr. Genevieve Reed is the executive director. She'll be coming along with her team, and they're going into the villages to teach midwifery. I mean, the midwifery is the way that most babies are delivered, and that's really great, except that, it's really the conditions are very difficult. In fact, when we were there in 2014 and gave one of the midwives a headlamp, she was ecstatic because of having to deliver the babies with one hand holding a flashlight. So Dr. Reed is going to be doing wonderful work with the midwives in the villages. We also have 2 massage therapists coming with us, and that is something that we hope we'll be able to teach massage to some of the villagers so they can treat the aches and pains, and maybe even treat us. We're really excited about this, and we're trying to buy some equipment. We'd like to have a portable ultrasound, a portable EKG. We want to buy some medicines and first aid equipment. The Dalai Lama Fund is basically has built the hospital and will furnish it, and we'd like to start with bringing the equipment that'll be needed. We're planning to go back again after this. This is a learning mission. We'll be delivering healthcare, and we'll know a whole lot more about what's needed next year. We need your help. Please send us any amount of contribution will be really appreciated, and will go directly to this project, directly to helping these people. These two children behind me are some of the patients that we saw in 2014, and we're really excited about going back to this wonderful culture and helping them get their medical program started. The one other thing I wanted to mention is we are working hand in hand with the traditional Amchis. One of the Dalai Lama's wishes was that the East and the West come together in this hospital, and so the Amchis are going to be there treating patients with their herbs, and we'll be treating with Western medicine, and I think it's a good fit. So again, thank you, and please contribute through Indiegogo, or go to tibetchild.org is the foundation's website. Thank you. Jule.
Jule.